hypoglycemic agent. First of all, I would like to break down the oral hypoglycemic agent. Oral means oral route, hypo means lower, glycemic means blood glucose level, and agents means drug. It means drug which is responsible for reducing the blood glucose level is known as oral hypoglycemic agent. That is, drugs used to lower the blood glucose level which are effective orally. It is known as it is also known as anti-diabetic drugs also. Regulation of a blood glucose level. This is done abnormality in glucose. This is due to the abnormality in the glucoreceptor, reduced in the number of the beta cells, reduced in the chance of changes in metabolism of the glucose, leads to the diabetes mellitus condition. Types of a diabetes mellitus. There are two types of a diabetes mellitus, that is type 1 diabetes and other is type 2 diabetes. One is insulin dependent and other is non-insulin dependent. Type 1 is a type of diabetes mellitus which is known as insulin dependent diabetes mellitus, which is also known as IDDM, which is also known as juvenile onset diabetes mellitus. It has a less genetic influence and less common type of a diabetes which is usually occur in the children's only. Therefore, it is termed as juvenile onset diabetes mellitus. In this, destruction of the beta cells of the pancreas, which results in the formation of the nitrous oxide or a low insulin level in the blood, which is eventually leads to the increase in the blood glucose level within the circulatory system, which is responsible for the creation of the hyperglycemic condition. Hyperglycemic condition is a type of a condition in which an increased concentration of the blood glucose level within the circulatory system. This is due to the destruction of the beta cells of the pancreas, which is responsible for the production of the insulin. Since no insulin secretion, patients need external insulin, that is insulin injection. Therefore, it is known as insulin dependent diabetes mellitus. Next is type 2 diabetes mellitus, which is known as non-insulin dependent diabetes mellitus. In this type of a diabetes mellitus, sometimes the beta cells are not enough capable to produce sufficient quantity of insulin, or sometimes they produce but the cells are not enough capable to consume that produced insulin. It is also known as maturity onset diabetes mellitus. It influences the high genetic materials also. More common, this type of a diabetes mellitus are one of the most common type of a diabetes mellitus in the current scenario. This occurred due to the abnormality in the glucoreceptor of the beta cells deficiency, decreased sensitivity of insulin to peripheral tissue. Other is reduction in the insulin receptor and obesity. Classification of the oral hypoglycemic agents. One of the major category is sulfonylurea. It is further divided into two categories, first generation and second generation. In the first generation, the drugs are tolbutamide, chlorpromide, and the second generation drugs are glycoside and glypride. Other category is biguanides. The big drug for the biguanides is metformin, and the other category is phenylalanine analogs, rapaglinide or netaglinide. Other is thiazolidones, in which the drugs are rosiglitazone and pioglitazone. Other is alpha glucosidase inhibitor, which the drugs are acarbose and maglitol. Sulfonylurea. All drugs have similar pharmacological profile. Glibencilamide, it lowers the blood glucose level in normal type 2 diabetic mellitus persons. It does not decrease blood glucose level in type 1 diabetes. The mechanism of action of sulfonylurea is first and second generation sulfonylurea. Sulfonylurea receptor 1, it acts on the sulfonylurea receptor 1, which is usually known as SUR1, which is present in the beta cell membrane of pancreas. It is responsible for the depolarization by closing of the ATP sensitive potassium channel, which subsequently increases the calcium influx. This increased calcium influx is responsible for the degranulation. Degranulation results in the release of the more insulin from the cells, which further upon releases into the systematic circulation, which subsequently reduces the blood glucose level. The pharmacokinetic profile of the sulfonylurea is all sulfonylurea are well absorbed orally. 90% or more are bound to the plasma protein, which is excreted unchanged in the urine. Should be used occasionally in patients with liver and kidney dysfunctions. What are the drug interactions related to the use of the sulfonylurea? It is as listed: inhibit metabolism or excretion of the cimetidine sulfonamides, displays protein binding of salicylate and sulfonamides. What are the ADRs related to the use of the sulfonylurea? First is hyperglycemia, nausea, vomiting, flatulence, constipation and hypersensitivity. The dose recommended for the use of the sulfonylurea drugs are 5 to 15 mg per kg. Next category is biguanides. Two biguanides anti-diabetes are there. First is fenformin and other is metformin, which are commercially one of the most commonly used type of a medicine in the current scenario. Because of the lactic acidosis, it is the what is lactic acidosis? Lactic acidosis is a physiological condition in which low pH in body tissue and blood, which is also known as acidosis, accompanied by the buildup of the lactate. Cells are forced to metabolize glucose anaerobically, which leads to the lactate formation. Fenformin was withdrawn from the market and was banned in India from 2003 onwards. Currently, the apart from fenformin, metformin is the current player which is leading the market. It is different from sulfonylurea. It does not increases insulin secretion. Particularly, I would like to suggest that please highlight that it does not increase insulin secretion. It does not produce hypoglycemic or in normal peoples. What are the mechanism of action for the biguanides? It is not clearly understood. Hypoglycemic action may be due to the suppressed gluconeogenesis and glucose output from the liver, and hence insulin mediated glucose disposal in the muscle and fat, retard intestinal absorption of the glucose. What are the pharmacokinetics? Not metabolized at all. Lactic acidosis less common. What are the ADRs? Abnormal pain, nausea, metallic taste and lactic acidosis. The recommended dose is 0.5 to 2.5 mg per day. Other drug is phenylalanine analogs. Normally mealtime glucose increases. Acts like sulfonylurea. What are the mechanism? The mechanism is maglitide acts on the sulfonylurea receptor 1, which is present in the beta cell membrane of pancreas. It depolarizes the ATP sensitive potassium channel, which increases the calcium influx and results in degranulation of the cell, which the degranulation process results in the increased secretion of the more insulin. This increased secretion of insulin results in the decreased blood glucose level. It produces rapid short-lasting insulin release, administered before each meal to control major postprandial hyperglycemia. Dose should be avoided if the meal missed, otherwise it may lead to the risk of a serious hypoglycemia. What are the pharmacokinetic given half an hour before each meal for limiting postprandial hyperglycemia? The recommended dose is 1.5 mg to 8 mg per day. Next is rosiglitazone. Rosiglitazone is a type of a novel class of oral anti-diabetic drug active against type 2 diabetes mellitus but not type 1. What are the mechanism of action? The mechanism of action is it acts on the it is a selective drug, acts for peroxisome proliferator activator cells, which is PPAR gamma, which increases the transcription of the several insulin response genes, which reverse insulin resistance by stimulating GLUT4 expression and translocation. The GLUT4 expression and translocation results in the improve the entry and exit and entry of the glucose into the muscle and fat, which results in the reduction of the glucose from the circulatory system, due to which lower serum triglyceride level, increased HDL level without much increase in LDL level. Pharmacokinetic is well absorbed orally and it metabolized by CYP2C8. Drug interaction related to the PPARs inhibitors are less marketed drug interaction available, oral contraceptive failures. Next is alpha glucosidase inhibitor, other category. The drug is acarbose and reglibose. Postprandial glycemia is reduced without increasing insulin level. It is a complex oligosaccharide, acarbose. The mechanism of action of acarbose is it reversibly inhibits alpha glucosidase. Alpha glucosidase is an enzyme which is responsible for the digestion, dilation and absorption of the glucose. Decreased in digestion and absorption of the polysaccharide and sucrose. Postprandial glycemia is reduced without increasing insulin level. The pharmacokinetic is minimally absorbed orally. ADR is fluid abdominal discomfort and loose stool. The recommended dose is 50 to 100 mg TDS. It means the dose is given in 3 times per day. In the current market, newer antidiabetic drugs are SGLT2 inhibitors, DPP4 inhibitors, GLP1 receptor antagonist, and inhaled insulin powders. Imagination decides everything. That's what I want to recommend over here. That's all. Thank you so much.